Welcome, everybody, to the Amplify Long-Term Care Podcast. This is the first episode of our relaunched podcast. My name's Frances Nahas, and I'm your host, and I'm thrilled to be here today with Lindsay Dymowski.
I am so honored to be your first guest. This is so exciting that it's a relaunch.
Where are you? In fact, I actually was born in Reading and then lived in Allentown before my family moved to Texas. So where are you in Philly?
So I actually was born right in Fishtown, which was not a great place to be when I was born there. So my parents moved us out to the Jersey side, and
nice.
we lived over in Haddonfield. And then interestingly enough, our pharmacy is actually in Fishtown on Delaware Avenue. I'm not sure if you're still familiar with Philly, but they actually built a casino right on the Delaware.
Seriously?
Yeah.
Yeah, on the Delaware. Yeah.
On Delaware Avenue. I like Delaware and Frankfort Avenues is actually where the casino is. And there's a couple office buildings that are across the street from it. And we're in the office building right there.
Oh, very cool. That's really awesome.
Yeah.
Yeah, fun. Yeah. I was like, I still occasionally have a word that gives me away despite having lived in Texas for many, many years.
I know.
Like, I can't help it. It's water. Like that's, that's like the one that's like my dead giveaway.
Yeah. My husband gets so frustrated with me because like, the angrier I get, the more I sound like I'm from Philly. And so
he's like, where is this coming from?
Yeah. He's like,
you're like, but I am from Philly. So,
yeah, born and raised.
Right. Too funny. Lindsay, why don't you introduce yourself and tell everybody about how you got into long-term care?
Sure, absolutely. Well, my name is Lindsay Dymowski. I actually grew up in independent pharmacies. So being in long-term care was something that I never expected, but here we are. My family had, multiple independent pharmacies while I was growing up, and I was that little girl making my allowance at the cash register, making sure.
Very common. So I feel like so many of them are like, I grew up in the shelves of the pharmacy.
True.
Yeah.
It's true. Some kids had to make their beds. I had to go put the pills on the shelf. It was, that's how I grew up. And when I was in college, my family and I actually started to do some more like medication management services and organization. So we were filling pill boxes, and then we started getting into kind of like manual blister pouches.
Yep.
And we started looking into how technology could advance what we were doing. So we ended up looking into pouch packaging. We got pouch packaging into our pharmacy, and then we started to go to the hospital systems, the payers, different people within the integrated health network in Philadelphia, because we were so fortunate to be in Philly, which is a huge healthcare hub.
Yep.
We started working with different organizations and saying, we can actually help you. We can help the patient stay adherent, which is going to help your metrics. It's going to not only support the providers, but it's going to support the health of the patients. And let's start to see what we can do here. We were able to get several hundred people within the first year onto our program. And at that point, we knew that we had something different. So we started to market ourselves as a medication management company. We launched Centennial Pharmacy Services, and we actually decided to go closed door because what we were doing was providing different level of support to patients than you would typically see at a retail pharmacy. So we decided to go closed door, but still support community patients. And that's how we got into long-term care at home. We really just wanted to jump right into working with the PSAOs in a deeper way to be able to prove that this model was a real model and it can be successful and it can be beneficial to not only the outcomes of the patients, but the outcomes of the plans with their total health spend savings.
That's really awesome. So do you still do the community pharmacy component today, like a normal retail pharmacy, or are you guys 100% switched to a closed door?
We have 100% switched to closed door, but that's what makes long-term care at home so interesting is that you're still part of the community. So we're still embedded in the community in the sense that the providers know where we are. Yep. The patients know that we have a physical location. It's not, back in a warehouse or anything like that. And we're still part of community events. We're still seen as a community pharmacy, but we just provide this greater level of support that enables the patient to live more independently in their home for longer.
That's awesome. So can you describe for folks who might not know what the difference is when you say we're closed door? Like, how does that impact licensing? How does that impact sort of your operations?
So essentially, closed-door pharmacy, you don't allow public prescriptions in. So you don't necessarily allow a patient to come in and hand a prescription over the counter. Everything that you receive is directly from the doctors, and you're dealing directly to the typically facilities.
Right.
But now we're able to do patients in their home, at the community, by delivering that medication out. So no patient is specifically coming to the pharmacy to pick up a prescription. It is different licensing. So you had your retail MPI and you had your long-term care MPI. And that long-term care MPI is what we operate under with a closed-door pharmacy versus retail.
Yeah, that's very cool. So describe like the evolution of long-term care to the home and how you see that grow. It's definitely something we hear in the long-term care space all the time. And so tell us a little bit about what it is, why it's growing, where you think it's going to go.
Yeah. Well, it's really interesting because it's kind of right now this gray space that people are like, is there really long-term care patients in the home? But yeah, there are actually long-term care patients in the home. And there are so many different like regulatory bodies. CMS actually in 2021 released a statement that acknowledged that there was long-term care in the home. So I think what really started this was you had groups of independent pharmacies who really were providing higher levels of service that should be considered long-term care at home, such as consultation, delivery out of necessity, packaging out of necessity, and just more holistic medication management services rather than just convenient pharmacy services. And then you have the long-term care community who is supporting the patients at the point of discharge, through the point of discharge, and in the home. And these two worlds kind of merge to create this at-home sector. And I think for a little while there was kind of arguments on who owns this sector. Is it a
Right.
independent play? Is it a long-term care play? Like who really belongs in this space? And one of the reasons why I refer to it as long-term care at home pharmacy is because I think that best reflects how you're paid for the service and the type of service that you're providing. I think that, as much as I'm a huge advocate for retail and independent retail, I think that there's sometimes more respect in the long-term care world. So I think when you can push that you are providing long-term care levels of service and you're supporting the patient in that way, you can get paid properly for it. So it really was just these two sectors meeting at one space in the home and providing this service to patients. And what was found was that you had patients who could potentially go back into a facility or even back into the hospital. But when you provided this greater level of support from the pharmacy, you were able to help them stay in the home. And that started to get a lot of acknowledgement from CMS, from payers when it comes to their total health spend. PBMs, everyone all of a sudden was going, wait a minute, pharmacy has a role here. And
and a big role,
we can
at this point.
A big role, a huge role. And, we're able to help the healthcare system save a ton of money, millions and millions and millions and millions of dollars. So it's exciting because it's only a sector that's growing.
Right.
I know that there was just a report released by McKinsey that stated that some $250 billion were moving from facilities to the home for Medicare dollars. And that's huge. So there's a big opportunity here. Healthcare in general is pushing a lot of primary care at home, hospital at home programs, and pharmacy just fits perfectly into it.
Yeah. And if I think about, growth in the population and not growth in long-term care beds, right? We'll need another solution, especially over the next couple of years, of how do you deliver services for all those patients who are going to need a higher level of care, but there isn't actually a bed in a long-term care facility for them.
Exactly. There's not enough beds. It's too expensive to make the beds, and it's not cost effective to have people in beds. Not to mention that who really wants to go to a facility? If people can stay home and be taken care of from the comfort of their home, they'd much rather have that, be around their family, their friends. They can still have, access to their life that they don't necessarily feel like they have access to when they're in a facility.
Did you see a big change with the pandemic in that? It's something that I feel like was talked a lot about early on, of people now not wanting to go into a facility. So how has that changed the dynamic for you guys?
I think that facilities started to scare people during the pandemic.
Yeah.
And, to an extent, I think facilities got a little bit of a bad rap.
Yeah. Yeah.
Sure. It wasn't necessarily the fault of the facilities that this outbreak
Right.
happened, but, they're just poised for things like that to happen. But I think that people really started looking at where am I going to age? And, people like me, I started to look, my parents are still young, though they
Right.
won't like me saying that I'm thinking about them going into a facility. But, I started to think, what is going to happen to my mom and dad?
Right.
I don't want them aging in a facility. I want them to age in the comfort of their home. So, I think that there was a huge shift in the way that people thought about care. And I also think that COVID enabled a lot of different regulatory things that impacted not being able to provide care in the home. It enabled it to kind of open up and almost have beta testing on, does this work? Is this effective? Can this be done? I think that there was a lot of fear in healthcare that if we embraced telemedicine or if we embraced home programs, that the doctors that are at facilities or at hospitals or, these big integrated health systems that are built in the cities would kind of lose their purpose, but that's just not true. What it does is enables the providers who can take care of people in the home to take care of them more cost effectively, more efficiently. And then the patients who need to be either taken to a facility or seen by a system for some reason can go to that facility and they can be seen and they can be focused on the care that's provided there. They don't have to worry about the little things that can be taken care of in a home setting.
Yeah. So can you talk a little bit about sort of compare, contrast traditional long-term care where you're sending meds to a facility and often interacting with the nurses in the facility versus sending meds to a home? So what's the same, what's different?
So the biggest thing that you have in the at-home population is that a patient doesn't have a nurse to rely on providing medications. So when you're sending medications to a facility, you're actually sending them to the floor, and it's going to the lead nurse, and that nurse is handling the med pass, and you have someone who is licensed, taking these medications, handing them to that patient, and making sure that they take them. In a home setting, that nurse piece is missing, but that's where the pharmacy can really embrace the medication management piece and provide the tools and the resources for patients who are capable and don't need that level of MedPass support to take their medications independently and effectively and still make sure that they're treating their conditions as they need to. So the pharmacist in a long-term care at-home pharmacy is still going to be packaging medication, consulting with the patient, doing DURs, doing medication reconciliations. All of that clinical care that you see in long-term care pharmacy is still happening in the at-home setting, but it's the end user of the medication and the end responsibility of a person taking their medication is that patient. It's that person. The responsibility of who's taking the medication at a facility tends to lean on the nurse. So the at-home pharmacy can actually support the patients who don't necessarily, how do I want to word this? Who don't necessarily want to go into a facility, who are still independent enough to manage their own medications, but they just need support on other things.
Right.
They can stay in their home, get their meds. And then those who do need the support for a med pass can go into the facilities.
How often are you working with sort of families or caregivers or home health organizations? Is that a component of your practice?
It is. So all the time. One of the things that's really neat about the long-term care at home sector and what the independent community pharmacies that want to get into long-term care at home need to realize is that you are having extremely thorough conversations, clinical conversations with caregivers that are in the home, with the nursing staff that may be in the home care agencies, even providers who are supporting care in the home. You're part of that care team. And I think that's different for your normal community pharmacy. We're kind of always left out on the sidelines, or we always want to be part of it, but we're not really seen as the entity that should be part of the care team.
Right.
And when you start getting into the at-home sector and you're providing this level of support to the patients and you're kind of the quarterback in the medication management for everybody who's involved on their care team, you're embraced as part of the care team, which is a really, really neat thing for a pharmacy to experience, at least in my world of pharmacy. I've never experienced that in traditional retail. So it was welcomed with open arms when we got into long-term care.
That's awesome. Talk a little bit about the billing. You mentioned, right, it's different than sort of a traditional community pharmacy. How's it look relative to community pharmacy? How's it look relative to traditional long-term care?
So when you are billing a long-term care patient, you can actually bill them under your long-term care NPI. One of the things that is kind of, let's say, confusing in this sector right now is that not all the PBMs are necessarily recognizing that long-term care at home is a billable population. So there are some PBMs that are paying for long-term care level of service at long-term care rates, and then there are PBMs that aren't.
Should we name drop the ones that aren't, just to encourage them to to move along?
I would love to. Am I allowed?
Sure, why not?
I mean, so there's two big national payers who currently are not paying for long-term care in the community. There are other national payers who, may have regional plans or regional programs that are recognizing long-term care at home. The thing that's really interesting about it is that all of the PBMs and all the payers know that this exists, and they know that this is something that is going to have to be paid for in the future, as long as it can have proper oversight and it can be regulated, and they can trust that the pharmacies are not just using this as a let's get out of DIRs.
Right.
One of the biggest thing is that this is not an easy, I'm not going to have DIRs anymore play for pharmacies. This is a different type of pharmacy. It needs to be treated like a different type of pharmacy. You need to have proper documentation. You need to have the attestations. You need to be able to provide this level of support and prove that you're providing this level of support so that you're paid properly for it.
Right.
And I think that as there are pharmacies who come into this market and are able to prove that there's true documentation and true attestations for this, you're going to see all of the payers eventually start paying for it.
So it's kind
at least that's my hope.
Yeah, it's kind of a push-pull between, the logic and the argument is, hey, we're going to have a whole lot of patients we need to take care of. There's not beds in long-term care homes. And there's actually a more cost-efficient and higher patient satisfaction model. And also, you have the need to be able to sort of document and verify the activities that you're doing, that you truly are delivering the level of care that's similar to or near what's in a facility, right? So it's interesting to think about sort of the national payers. Are they balancing, hey, there's a cost play here, right? So it should be more efficient. They should want to encourage it. And also they need to know how to track and build the systems and everything to be able to document the level of care that's given. Yeah. So it's an interesting balance. Yeah.
It is. And, it's funny because in the pharmacy world, you kind of always want to be against the PBMs.
Right.
Like they're the enemy. But, I totally understand where they're coming from. This is a new world in pharmacy. And how do you really start to pay for something that hasn't been done before?
Right.
You need to make sure that pharmacies are doing this properly. You need to make sure that there's protocols and procedures that are in place so that there's proof to this model, and that they can trust that the pharmacies are doing this properly. That's actually one of the reasons why we launched the Long-Term Care at Home Pharmacy Network, because there is so much gray space in long-term care at home that there needed to be someone in the pharmacy world who was making this black and white and who was willing to say, here are best practices, here are protocols and procedures, here are attestations and qualifications for patients. Here's what's going on in the regulatory world, and how can we advocate for this?
Right.
That's kind of where the Long-Term Care Pharmacy Network was, or the Long-Term Care at Home Pharmacy Network was born.
So tell us about it. Where can folks find more information? What's the goal? Tell us about the network.
Absolutely. So, obviously, best information is always on the website.
Right.
So our website is ltcah.com. It's longtermcareathome.com.
Perfect.
And essentially, the goal with this is to be able to be a centralized hub for everything long-term care at home. So we're doing a lot of work with different organizations to make sure that this is properly recognized. We're doing a lot of work with different entities to make sure that this is properly paid for.
Right.
And we're organizing what is the best practices, the procedures, the attestation sheets for patients, the different documentation that's needed, like your med reviews and your DURs that have to be done on a monthly basis. We're making sure that everybody has the policies and the procedures and the different types of processes that go in place with this so that they can effectively run a long-term care at home pharmacy and they can have the proper documentation to be paid for it.
So let's talk about sort of we'll start from this side. If you're a community pharmacy and you're thinking about getting into long-term care at the home, what's some advice you would give somebody doing that?
Yes. So one of the biggest things that community pharmacies want to remember is just to document everything that you do, because the community pharmacy is so used to doing so much and not getting paid for it that
right.
you want to make sure that you document it. Second, the pharmacy world has this really cool thing now that's called a combo shop pharmacy. And combo shop allows you to have a retail NPI and a long-term care NPI under the same location. So don't question me on the nuances of state by state. I cannot confirm if it's approved in every state.
Right.
But what I can tell you is that this enables you to get paid properly for those patients that qualify for long-term care at home under a long-term care NPI without having to open a whole new pharmacy or utilizing completely different staff to do it.
Yeah. So let's think about it from the other direction. So we have a lot of customers who are big scale long-term care pharmacies delivering to SNFs, assisted living facility. If they want to start doing long-term care to the home, what are some of the things they need to think about that might be different from what they're doing today?
Discharge. There's so much opportunity for long-term care pharmacies at the point of discharge. And, I haven't been in long-term care pharmacy for a long time. I grew up in community world, and I still very much see myself as a community pharmacy. But there is so much opportunity for long-term care pharmacies to really get into supporting the patient at discharge. And I think that there's been a lot of efforts with that as far as being able to do that last fill and send that fill to the home. But don't let that patient drop off. A lot of times those patients still need additional level of support. They still have services in the home that would qualify them for long-term care. And there's just so much capability on the pharmacy to be able to support that patient and make sure that they're hitting their metrics. And I say they're hitting their metrics as the facilities and the hospitals are hitting their metrics with their rehospitalization rates, their PDC rates. You have those patients, you already have their information, you know what medications they're on, you know who their doctors are. You have to be able to support them in the home. So I think if the long-term care pharmacies can start really embedding themselves with discharge teams and marketing themselves as a pharmacy who can help support those discharge teams, get that patient home safely and stay home, there's just a huge opportunity there for long-term care to pick up in the home.
So you're working directly with sort of hospital teams and rehab facilities or other facilities that might have patients for a period of time and then send them back to their house? Is that where you're building those relationships?
So there's opportunity for relationships to be built there. At Centennial, again, we started as a community pharmacy. Yeah. So we actually do the community side where we work directly with the providers and different entities that are in the community, like social work and care coordination companies. You have home care companies, and we get referrals for patients that way. I think that's probably the market that community pharmacy would want to focus on. And then your long-term care pharmacies are going to want to focus on your big facilities that are discharging and how can I keep that patient healthy and happy in the home post-discharge.
particularly if you've already been serving that patient while they were in a facility, right?
Yes. I
Yeah.
have conversations with long-term care pharmacies a lot, and I'm like, you guys have all the information. Like in the community world,
Right.
we have to fight for the information. We're like, who's the doctor? Where's the med list? What patients are
Right.
they seeing? Where are the 45 different pharmacies that they're getting meds from? And at the long-term care pharmacy, they do all that work at the admission. They get the patient, they
Right.
get the meds, they do the med rec, and it's everything's there. You just got to keep the patient.
Right. Super interesting. So how can folks get involved? This is something we talk about a lot, which is, hey, there's a tremendous opportunity to be a voice for change. Where should folks engage if this is something that's going to grow? And one of the things I always think about with pharmacy is going to grow and making sure we're doing the things that ensure pharmacists are going to be paid for the services they provide. So like you said, right, there's a lot that pharmacists do that they don't often get paid for today. So how do we think about how folks kind of get engaged?
Well, I think that first and foremost, the pharmacies really need to advocate for themselves. And
Yep.
there are so many different ways that you can do that. And I'm not even talking about, I'm not necessarily talking about like political advocacy.
Yeah.
Join your associations. There are so many different associations out there that are beneficial to pharmacies where you can join these associations and you can, find the person who's focused on long-term care or long-term care at home within that association,
Right.
and reach out to them and say, hey, this is what I'm doing. I think that it's different. I think that I could help you gain traction in this. And those groups are so willing to work with pharmacies to get them to the right people or to get them seen and heard in different ways. And you can't be afraid to reach out, advocate for yourself, and make those initiatives. Second, if you're looking, strictly for long-term care at home, absolutely go to the long-term care at home pharmacy network. Our whole goal is to just advocate for long-term care at home, to be able to grow this market, to hold hands for pharmacies that are willing to support this sector, and to make sure that we're there and that we're progressing this sector forward. There's also a really cool steering committee. It's called the Alliance for Pharmacy at Home, and it was actually formed by some of the major associations and big long-term care pharmacies in the world.
Yeah.
So you can find out more about this alliance. It's pharmacyathome.org. And this alliance is essentially based out of Washington, and we are focusing on making sure that this sector is approved, that long-term care at home has a voice, and that we can talk to the people that we need to talk to on Capitol Hill or in CMS or wherever it may be, to get this to be a recognized level of support for patients.
That's fantastic. So this is going to be me being nerdy person at the technology company. What do you wish you had to do your job better that maybe you don't have available to you today?
That is a really good question. I wish that speaking of technology, I wish that there was a comprehensive platform that just connected everybody. I think healthcare is so segmented, and I shouldn't say segmented, it's fragmented. Healthcare is very fragmented.
Yeah.
And I think that if there was just something out there that got everybody on the same page and gave everybody the same information and everybody could collaborate and talk to each other on it, it would make everybody's world a better place.
Right.
Yeah.
The dream.
Everybody's.
This is what we're going to work for. The healthcare dream. Like, can we just get the information in one spot?
Exactly.
Yeah. And if folks want to work with you, tell us where Centennial Pharmacy is. Where can they find you?
Centennial Pharmacy Services is in Philadelphia. We actually support all of Philadelphia and the surrounding counties. So if you are a provider or a home health agency or anyone within the Philadelphia community, we are more than happy to support your patients. And then if you are a pharmacy and you're interested in getting into the at-home sector, but you're not quite sure how to do it or where to go or what the resources or tools are, please visit the Long-Term Care at Home Pharmacy Network. It's ltcah.com, and you can join. Membership gets you access to all of the different tools, resources, best practices, compliance documentation, and anything else that you may need to effectively run an at-home pharmacy.
Awesome. Fantastic. Well, thank you so much. This has been super fun chatting with you.
Yeah, it's been great. Thank you.
Thanks for being with us today, everybody. This is our relaunched pharmacy podcast for long-term care. It's Amplify LTC podcast, and you can find us on YouTube, Spotify, or Apple Podcasts. Please subscribe and continue to listen for great conversations around long-term care and how to elevate your pharmacy.